Hey guys, this is Philecia. This is part 2 of our Breast Cancer Awareness Month segment, and this is my story. Before I was diagnosed, I was actually misdiagnosed. I was at the movie theaters and I adjusted myself in a sports bra, and that's when I first found the initial lump in my lower left breast. Shortly after that, I went to the free clinics because I did not qualify for any type of insurance. I was underqualified for some and overqualified for others. Other than this lump, I was perfectly healthy. I had no symptoms. I was a CrossFitter, runner, camping, riding motorcycles, modeling, working full time, you name it. I went and I had an ultrasound. About a week later, they came back and told me it was a benign cyst. There was nothing to worry about. Come back if it bothered you aesthetically or hurt in any way, that I was too young to have cancer. My doctors and I tried twice to request a mammogram. I was denied both times solely based on my age. They said that 29 was too young to have cancer. I was 29, gonna be 30 in a month. So about 8 months goes by and I had an accident snowboarding. I kind of fell on my chest and it was bothering me. And at that time, it actually grew to almost 5 centimeters. So it was really bothering me aesthetically. I have a bigger bust size, so it wasn't crazy bothering me, but enough. I went back and they did another ultrasound, which resulted into an emergency mammogram, which I was denied before. That turned into an emergency biopsy, actually 6 biopsies on both breasts. Then that turned into a PET scan, and from there that turned into stage 4 breast cancer. It had spread to both my lungs, my sternum, my left breast, and my lymph nodes. So I was officially diagnosed right before my 31st birthday. After I got the official diagnosis, you see a primary doctor, again, at the free clinics. And when I walked in to that appointment, she had the word cancer highlighted on a piece of paper. It was a very rough way to tell someone that they had cancer. She didn't know my stage. At that time, she did not know my PET scan results. She immediately had me go to the breast cancer center, where I was officially diagnosed with stage 4. The feelings I had, I don't really remember walking out of the doctor's office. I was with my boyfriend, and from what I was told, I was hysterically crying, hyperventilating. I really don't remember any of that. I don't remember anything she said. I just know that I had cancer and they told me I was fine less than a year later, and then it was nothing, and now I have cancer. Throughout the weeks of appointments and trying to really wrap my head around what was happening and trying to understand how they told me I was too young to have cancer, and now I'm here having emergency biopsies and emergency appointments and seeing a surgeon and seeing an oncologist and seeing a family doctor, and I mean, it was just weeks of back-to-back appointments every single day. I was angry. I was so angry that the system had failed me and told me that I was too young to have cancer, and now here I am, all of a sudden getting all the care in the world and all the tests that they wanted to fulfill. There was no question, there was no hesitation, they just did it. Where was that a year later when I had tried telling them that something was wrong, that I felt something that was not normal to my body? I really don't understand how they said, it's nothing, don't worry about it, without more than just an ultrasound. So my emotions, of course, were, what do we gotta do? How do we fight this? I gotta get through this. Just let's get the appointments taken care of. But I still hold a lot of resentment and a lot of anger. While going through cancer, they do ask of your family history, and I did do genetic testing to find out what gene I had. They ask if there's any family history. For the most part, no. There is a small portion of my family that I don't know about because my grandfather passed away when my dad was very young, so we were not connected to his side of the family. But the most family history that I have is in my grandmother's side, on my father's side. Paget's disease runs in that family. Paget's disease is not breast cancer, but if left untreated, it can turn into breast cancer. But directly in my family, I have no history. So the doctor kind of said it was like a victim in a drive-by shooting, just luck of the draw. Going through cancer and being through the diagnosis, it is life-consuming. It changes every single part of your life. There's not one part of my life that was not touched by it, no matter how hard I fought that. And the best way for anyone, including myself, to get through that is my support system. In Southern California, I don't have a ton of family. My mom lives in San Diego, which is a couple hours south. My brother's in San Jose, which is a few hours north. But I have an amazing boyfriend that has picked up every piece with me, and I have the most amazing friend group that is by my side no matter what I've needed. They bring me food, they support me, and I think for myself, the biggest support system outside of my friends and family has been social media. The amount of people that I have met, thrivers, survivors, doctors, you name it, I've met them through social media, and it has been such an amazing community to come together, to not feel alone, to vent on days when no one understands what you're going through. Especially in today's day and age, that's just kind of like our life now is social media, and I'm really glad that I could turn this into a positive for myself. So I have an amazing support system from start to finish. With my diagnosis came chemotherapy. So I had a port that was placed right here. That port is accessed by a needle, and it goes into my main artery that goes directly down into my heart so that the chemo is evenly dispersed throughout my body. It's also one of the only veins in your body that can really handle the amount of chemo. A lot of patients have difficulty in their arms if they use those, and I didn't want to damage my arms, so I chose the port. I had 6 rounds of IV chemo. The first round of chemo that I had was with my first oncologist, whom I fired, which is a great tool to know that you can fire your doctor and your nursing staff if it's not working for you. That round, I lost 8 pounds in 3 days. I hadn't drank water in 2.5 days or eaten in almost 72 hours. I fired my doctor immediately and went to another oncologist. After seeing her, she gave me migraine medication, and I drank 3 bottles of water and ate my first meal in almost 3 days. Since then, I have had 6 rounds of chemo. I have had both my ovaries removed. I have done fertility and saved 10 healthy eggs. I have had countless rounds of infusions, injections, oral medications. There's just so much more that you can't even list, and that was in less than a year's time. I believe I had done all that in 11 months. The biggest hurdle that I have had to deal with is the weight gain, the constant changing of medications, on one for this procedure, off one for another one. I had 2 surgeries back to back, one day, one the next day, and that was really difficult. But I think the biggest thing is just finding my new self. I don't recognize myself. I don't recognize myself in the mirror. I don't recognize my own mind, my body. It's like getting to know a whole new person. And at my age, at 30, I feel like I was finally finding myself. 20s were great and fun, but 30s, I was really feeling like me. And so to have that completely thrown and changed was really difficult. I'm so thankful for social media because it has really opened the doors to meet people that I would never meet in regular day in life, just out and about and at the treatment centers. There's a joke in the cancer community that we call people without cancer muggles, and it's kind of hard to relate to the muggles. They try, and people try so hard to relate to you, and they really try to connect, and unfortunately sometimes people connect in the wrong ways, which we can get into that later of how to not connect with cancer patients. But social media has just opened doors to meeting so many other fighters, and with my stage there's a lot of negativity around it, and there's not a lot of hope. We deal with a lot of daily basis of statistics, and we are not meant to make it after 5 years, and stage 4 is terminal, and it's very negatively looked at. But with the beauty of social media, I have found patients of 20 years surviving stage 4, 10 years surviving stage 4. I was introduced to a lady that her grandmother passed away at 71 years old with stage 4 breast cancer, and that in the community is everything. With breast cancer, I mean, it definitely makes you question everything in the future. You know, you have those hard moments, the what ifs and how comes and what will happen next. But for me, I'm just concentrating on the positive. I'm concentrating on the people that I've met. I still want to model as much as possible. I want to spread awareness as far as I can. I want people to understand that this is not an older lady's disease anymore, that this is affecting younger and younger women. And just because you're diagnosed with cancer does not mean your life is over. You don't have to curl up in a ball and die. You can thrive, you can have a full life, you can fulfill everything that you want to do. Like, I still have goals, I still want to model, and I'm going to get back into that. So to work with House of Lashes and connecting me with different people is everything that I want for my future, and I will continue to thrive doing so. And if you're a patient or if you're a supporter and you have any questions, please reach out to me. I'm an open book, and I would love to help connect you with the tools to thrive in your position, whether you have cancer or not. My day-to-day life has obviously drastically changed. It really depends on what's going on. Some weeks I'm more open. I have doctor's appointments, infusions, blood work. I take oral chemo 21 days on, 14 days off. So some days just aren't great days. I'm currently not working a full-time job right now. I'm recovering and thriving and getting back to my new self. I make crafts, I make candles, and I do some markets to keep myself busy. So I spend a lot of my days recovering, relaxing, self-care, working on my mental state, keeping my mental health number one, and keeping myself positive. Some days I like to sleep all day because I kind of overdid it the day before. All cancer patients know that every day is different and every hour is different. You could have a great morning and then your night is nothing. You could have a great week, so kind of just depends on what's going on. But I really try to concentrate on self-care and do one thing a day that makes me feel a little bit more special, or I forget that I have cancer. That could be getting a coffee or taking a walk on the beach or playing with my dog, going out of town. It really just depends. If I could give advice on preventative care, it would be doing self-exams at home. I had a lymph node in my armpit that was the size of a golf ball, but because it was behind my, I don't know if it's my pectoral, but my muscle, I couldn't feel it on just like a basic exam. You need to get in there. You need to feel around, feel your breast from top to bottom. Don't be scared. Have your partner do it, whatever you need to do. And if you feel something, immediately go to the doctor. I get so many messages from women that have told me, I felt a lump 6 months ago and I haven't gone. I've had women who their mother felt a lump. They went to the doctor because they saw my story and she's stage 3, now in treatment. It's nothing to be afraid of. It's scary and it's terrible and it's terrifying, but the sooner detection, the sooner the treatment, the better your odds are and the easier it's going to be for you. So if you feel a lump, if you don't feel good, if something's not right, immediately go to the doctor. And if you don't feel that you're getting the right answers, go to another doctor. There is no reason why you can't go to multiple doctors and get multiple answers. I wish that I had heard or seen or known of someone going through this, or told me ultrasound isn't good enough, that you need a mammogram, that you need to fight for your care. I would have done that. And I'm not saying don't trust your doctor, but do more research and really have a solid answer about what's going on, because an ultrasound is not good enough. You need 100% answers on what is going on with your body. If you don't know where to get that care, don't be scared to call places. Something that I have learned is there's a lot of these breast cancer foundations and cancer in general that will offer assistance for you. They offer free mammograms, free ultrasounds, free testing. They're not the ones that are gonna go out and tell you they do that, but if you call, they will help you. The way that I keep positive while fighting breast cancer is life is way too cool to give up, and I have so many other things that I want to do and see, and I have goals that I still want to reach, and I'm going to reach them no matter what. And one of my best friends in the entire world, when she first found out, she texted me and she said, listen, Phil, this is just an injury. We rehab and we recover. And I remember that every single day. This is just an injury. This is not who I am. And I'm gonna fight every single day to live life to the fullest. I'm not gonna live like I'm dying, because I'm not. I'm living because I'm living. My entire mission throughout my treatment is to spread awareness. If you're going through this, or you know someone going through this, and you need a little bit of help, guidance, vent or talk to somebody, I am more than welcome and open to helping everyone I can. You can reach me at my Instagram, which is at PHILECIA. I'm always open to helping you. If I can't help you, I can try to find resources or at least guide you in some way that will help make this journey a little bit easier for you. If you are someone that's a supporter and you want a little more insight of how to support them better, I'm absolutely open to helping you find ways to be there for your cancer fighter. Although this journey has been the most difficult thing I have ever gone through in my entire life, I know that I'm going to keep thriving throughout it. And if I can do it and I can stay this positive, so can you. I want to thank House of Lashes for having me on for this segment. It means everything for me to be able to spread the word of what's going on with young women and breast cancer. October is Breast Cancer Awareness Month, and if you know someone going through breast cancer, that is a month to celebrate them. With a lot of hard work and a lot of positive energy, I've had 2 clear PET scans. I have another PET scan on the 30th and my results on October 2nd, so stay tuned on my Instagram for those further results. Thank you so much, House of Lashes, for having me, and happy Breast Cancer Awareness Month.